Today we'll discuss about undescended testis. The testis, which normally develops within the abdomen of the child, gradually descends, and by the time the child is born, the testis comes out. In some children, at birth the testis is not seen, or it may not be felt. In any case, we do not do anything except to wait to see if it can come down. The incidence of undescended testis in preterm children is quite high because the testis still has not taken its time to come out. But in full-term children also it may not be descended. In any case, we wait at least up to 3 months for the testis to descend down. And still, we wait for at least 3 months more before we take a decision. In other words, till about 6 months of age, unless there is a pressing emergency, we do not need to do anything for such children. The testis, which does not descend by 6 months of age, needs intervention. Needs intervention by surgeon to see what needs to be done. At 6 months of age, we reassess the child to see if the testis is felt by hand or not felt by hand. If the testis is felt by hand, we call it as a palpable undescended testis. That means the testis during its normal course of descent has got stuck somewhere and it requires to be brought down. These children do not require too much of investigations because the testis is felt by the hand clinically. So in these cases, the procedure is very straightforward. We just take up the child for surgery, in which we make a little incision in the groin, mobilize the testis, and whatever is associated hernia, we fix it and we bring the testis down in a one-stage procedure. These children generally require a short stay hospitalization. The same evening that the child has been operated, the child can be discharged. I call them after about 2-3 days for the dressing to be removed. Generally, it's always absorbable sutures, you don't need to do anything. We call the child after a month just to see how he is and how the wounds have healed. Thereafter, the child requests to be following up with us yearly once till he attains puberty so that we can monitor the growth of his testis. Because some testis may not really grow, most of them do. So, the treatment of a palpable undescended testis is straightforward with no major options to worry about.